Okay, let's unpack this. We're pulling back the curtain today on diabetes blood tests. We want to help you understand what they really mean, and we're going to get specific, looking at the local experience in places like, say, Beeston in the UK. For this deep dive, we're working with insights from the experts over at Blood Test UK. They're specialists in private blood testing and do home visits all across the country.
Exactly. And our mission today really is to give you a bit of a shortcut. It's not just about what the tests are called. It's about understanding the big benefits of getting these checks done and doing them early.
Absolutely, because when a doctor in Beeston is looking at your blood sugar, it's not just one number they're after. They're building a picture over time.
That's it, exactly. I mean, when we talk about the key checks, you really have to know the difference between let's say, a long-term report and an immediate snapshot.
Okay, so let's start with that long-term report.
That would be the HbA1c test. It's your most important long-term indicator. It works by averaging your blood sugar levels over the past 2 or even 3 months.
Yeah.
So it's showing you what your habits were like, 60 days ago.
Right. So it's less of a quick checkup and more like a mirror. It reflects your recent lifestyle.
A mirror is a perfect way to put it.
So if the HbA1c is the rear view mirror, what's the test that tells you what's happening right now?
Well, for that, you've got a couple of options. You've got the fasting plasma glucose, or FPG. That gives you a clean baseline number, but you have to fast overnight for it. No food for 8 hours.
8 hours. Okay.
Then there's the oral glucose tolerance test, the OGTT. That one's a bit more involved. You drink a sugary solution, and they see how your body handles it over time.
And a quick one, if there's an urgent need.
That's the random plasma glucose test. It can be done anytime, no prep needed. And it's the local GPs, your doctor in Beeston, who are really the first stop for getting these done and figuring out what the results mean for you.
Okay, so you get all this data. What's the real payoff? Why should someone listening in Nottinghamshire make this a priority?
It's all about one thing, really: early detection. The whole point is to prevent problems, not just react to them. We know for a fact that timely testing prevents serious complications later on.
Like heart disease or nerve damage.
Exactly, those things. The really serious stuff.
And we see that in the local data, don't we? In places like Beeston, people who get diagnosed early have far better health outcomes. It genuinely improves their quality of life.
It does. And it's not just about prevention. For someone who already has diabetes, regular tests help doctors fine-tune their management plan.
To make it more personalized.
Precisely. They can adjust treatments based on real up-to-date data. That continuous feedback is just invaluable.
So if that early data is the foundation, what's next? What new tools are giving people more control in real time? This is where things get really interesting with continuous glucose monitors, CGMs.
Oh, CGMs are a game changer. They really are. Because they give you this constant feedback loop. You can see your levels instantly on your phone.
So you can see how that slice of cake or that walk you just took actually affected you right there and then?
Yes. It lets you make tiny adjustments to your diet or exercise on the spot, rather than waiting weeks for your next lab appointment. It puts you in the driver's seat.
Now let's go back to preparing for a test. You mentioned fasting for the FPG. That's really important, isn't it?
It's crucial. We can't stress this enough. You have to fast for 8 hours. I mean, we know it's a pain, but even just a splash of milk in your coffee can throw the reading off completely.
And give you a false sense of security.
A dangerously false sense of security, yes.
And what about the results? Is there a number people should really watch for?
There is. For the HbA1c, the critical number in the UK is 48 millimolar. If your result comes back above that, that's the diagnostic threshold for type 2 diabetes. It means it's time for immediate action. You have to talk to your doctor in Beeston and make a solid plan for lifestyle changes. Diet, exercise, the works.
So to pull this all together, getting these tests, whether it's through your local NHS clinic or a private service like Blood Test UK, is actually quite straightforward.
It is. The access is there.
But the real secret is the consistency. It's that regular monitoring that keeps you ahead of the game.
Yes. And here's maybe one last thought for you to take away from this. These tests, they don't just manage diabetes. They are probably your single most powerful tool for preventing it in the first place.
Yes, so.
Because they can identify prediabetes. That's the stage before you have the full-blown disease. If you catch it then, you have a real profound chance to change your path. To turn things around before it ever starts, I'd really encourage you to explore the information on the Blood Test UK site. It's all there.